Good day and welcome to A Place Called Through. I am the host, evangelist Patricia Wade Goings, and we do broadcast from WYTV7 Community Broadcasters Network. Here at A Place Called Through, we have real people who share real stories, stories that affect us everywhere, every walk of life. You know, we're all going through something. If we're not going through, we've been through something. And you know, many of us have actually come through. And that's what makes the difference as you go through and you get through. So today we're going to share with you some information that's very valuable to us all as we are still continuing in this pandemic, COVID-19. But you know, I want to share this one fact with you. We can only do this with you and for you through our mission of hope. So we ask that you continue to sow those seeds into the ministry at WYTV7.org. Give today and help us continue with our mission. Once again, we'd like to take this time out to welcome to A Place Called Through, Dr. Jan Kelly, who is here to share with us information about COVID-19. Welcome, Dr. Kelly, to A Place Called Through.
Well, thank you so much for inviting me.
We are so glad that you have time to take out with us today. Dr. Kelly will be soon retiring, so we're glad that she has found this time now to come on and talk to us today. Dr. Kelly, for our listeners and our viewers, share with them a little bit about your background, if you will.
Sure, and I'll share some personal connection to COVID-19 pandemic. I started my career in the early days of HIV, before they even was called HIV, when it was AIDS, and it was all a big mystery. No one knew what caused it or how it was transmitted. Early 1980s, very scary time. And in my career, I have seen it go from a terrifying, untreatable disease, killing millions of people, that we were just helpless against fighting it, to today, you can treat people with living with HIV with just one pill a day. I think back to those early days of HIV, and I relate them to what we're seeing today with COVID-19. People in kind of both camps, people who are very, very afraid and with so much uncertainty, and people who are just blowing it off as, well, this doesn't affect me. For me, in my career, I spent most of it in clinical medicine, taking care of patients, but a good proportion in public health. I used to work for CDC, Centers for Disease Control and Prevention. I retired in 2014, did a little bit of, consultant work for several years, but spent most of that time just sort of enjoying life and catching up with family and friends. And then COVID hit. When COVID hit in 2020, I knew we needed all hands on deck. And I came out of retirement. I'm currently working as the South Carolina Assistant State Epidemiologist for the Department of Health.
Well, we thank you for coming out of retirement because, you know, as you said, all hands on. There's a lot of help that we really need right now and appreciate as this pandemic continues. No one knows when it's going to end. We really don't even know where it came from, where it really started. But, you know, it's continuing. And as we have to learn how to live day to day in this pandemic because it's constantly changing. Lives are being lost, by the thousands and millions. And so we just don't know how to handle it. So, as we move on into this pandemic, what do you feel that we need to do? How can we do whatever is necessary at this point?
Well, I deliberately brought up HIV because I remember those early years, the degree of uncertainty and fear. And we have been facing that in these 2 years with COVID-19 as well, that sense of uncertainty. How should I move forward? Is vaccine safe? Should I get it or not? And I think we are in such a different situation than we were just 2 years ago. At this point, we know that vaccine is safe and effective. I understand why people in the very beginning were hesitant to get vaccinated. Everything was too new. We didn't know enough about the infection. It seemed like they developed these vaccines in such rapid time that, there's just so much unknown. What we know today is that almost 600 million doses of COVID-19 vaccines have been given in the United States alone. And there have been very few cases of severe allergic reactions or other complications. That vaccine has saved millions of lives. So I know there are people out there who still feel hesitant. They're still not sure. They still have questions. And I would just urge your listeners to get your questions answered. You know, you're in charge of your health. Find out if you've got a specific question, you're not sure where to turn. You are welcome to ask me a question. I'll be glad to give you my email address, or talk to your neighborhood pharmacist or healthcare provider, because we now do have a lot of information, and not just about vaccine, about some other treatments if you do happen to get infected with COVID-19. There are pills you can take. There are other medications that can be given by an IV that can help prevent progression to severe disease. So we have a lot more tools in our toolkit than they did in the early days of HIV, and a lot more tools than we had even this time 1 year ago.
And that's good to know, that there is more help and more information, that people can go to. I think the biggest thing that I hear is that there's such a fear, when it comes to even being vaccinated. There is such a fear of people not wanting to get vaccinated because some are saying, okay, well, the side effects did this to somebody else. Of course, we get into that hearsay thing instead of asking the officials. And in some senses, yes, you're saying ask the officials, but you don't have that whole component together because it's still unknown. COVID came and people just don't really know where it actually came from. It just happened. And again, yes, people are still trying to figure out, like you said, with HIV, they're trying to figure out how to treat these things. So yes, there's still a lot of unrest and people are uneasy about getting vaccinated. So how then do you encourage somebody, that really is having this unreadiness and uneasiness about getting vaccinated?
It's getting the facts and getting those questions answered. You're right that there is a lot of hearsay, a lot of rumors, a lot of people putting stuff on social media that doesn't necessarily have all the facts. So for example, side effects. Well, I just got my second booster today. I had Pfizer for my first series, and I just got my Moderna booster. Now, what can I expect? I can expect that my arm's going to be sore tomorrow, and I can expect that I might be tired, maybe not feel great. But I timed this deliberately. I knew that tomorrow was going to be an easy day at work, so I thought this is a good day to get vaccinated. The question becomes, where do you get your information? What is a reliable resource? I know for me, I go to the CDC website, but I know that not everybody likes going to the CDC website. I understand that there are some people who are suspicious. They don't like going to government websites. Well, you've got other resources. If you look up information at a school of public health or the National Medical Association and African American Medical Association, they have information on COVID-19. They've got contact information where you can put in a question and they can answer it. Morehouse School of Medicine, Howard School of Medicine, that those facilities, those schools, educational systems, they've got good information on their website. Emory University is another one that has good information on their website about COVID-19 vaccines.
And I would agree with you. Yes, it is really important to look for information, even with your health departments, your local health department. Go and find out the information, get the facts so that you'll know the facts and apply them to this situation. Because COVID-19 is here, it hasn't gone away. We can only pray that, yes, it will go away soon. But right now, it's an everyday thing. We're living COVID-19. Well, we want to stop right now for a quick commercial break, and then we're going to come back with you, Dr. Kelly, and talk about some more treating COVID-19, because so many people have been affected by it, as we said earlier, and so many people have lost their lives behind COVID. So we're going to stop now for a quick commercial break, and then we'll be right back with you, Dr. Kelly, here at A Place Called Through as we continue to talk about COVID-19, the effects and what you need to know. Stay tuned. We'll be right back.
80% of women will develop a pelvic health condition at some point in their lives. There is relief. There is hope. The Pelvic Floor Store your resource for personal health.
And welcome back to A Place Called Through. Today, our guest is Dr. Jan Kelly, who's talking to us today about COVID-19. And we're talking about the effects of COVID-19, why it's important to get vaccinated. And, still people have fears about COVID-19. There's still so much more information that needs to be shared with individuals. So, if you really want that information, there's tons of websites, go online. Don't be afraid to go ask for information. Your local health departments, the hospitals, health officials are here to help us all. Yes, there's still a lot unknown, but get the information, know the facts. Don't go by the rumors, go by the facts, because it will help save your life and may help save someone else's life. So know the facts, get the facts. Dr. Jan, we're talking about this COVID-19 and how it has affected so many people, all over, not in just one place. It is just a universal thing. So because it's universal, scientifically, there's so much still, would you agree, that still needs to be done? Because it just hit and nobody really kind of like knew what it was or how to even be prepared for such. And I can recall briefly how, when cancer first was discovered, my mom had cancer, but nobody even knew what it was back then. They didn't know how to treat it. They just kind of kept her in the hospital for months as she, until she finally passed, but they did not know. And see, I look at COVID in the same way. They really still are trying to discover a lot more about COVID. So bring us to this point scientifically, what's being done? Where are we with it?
You are absolutely correct that there is still much that's unknown, but I look at it as how much we have learned in 2 years. I mean, it's tragic to hear your story about your mother. And I feel like their tragedy still continues with people thinking there's nothing they can do about COVID. That's not true. We now have many tools for preventing COVID infection or for preventing severe disease if a person does get infected. Now, I'm a big proponent of vaccine. I shared with you earlier that I just got my booster shot, and I know that some people are afraid of getting vaccinated because they're afraid of those side effects. I just want to emphasize any side effects you might get from getting vaccinated are much milder than getting COVID-19 disease itself. But there's more to it than the vaccine. There are also certain treatments people can get if you do get COVID infected. So if you feel like you've got symptoms of COVID, whether that's feeling like you've got congestion, sore throat, headache, aching all over, symptoms that could sound a lot like the flu, make sure you know what you have. Get tested for COVID. And if you test positive, contact your local pharmacy as soon as possible. Contact your healthcare provider. But I know not everybody's got a personal doctor, but you always have a neighborhood pharmacy. Go to the pharmacy and find out if you're eligible to get a different treatment. There are pills that you can take for 5 days that'll help prevent COVID turning into a severe disease. While on the one hand, you're right, there's still things that we are learning about COVID. It's also true that we now have medications and treatments that can help prevent serious disease and hospitalizations, help keep you out of the hospital, out of the morgue.
And that's improvement, as you said, because when it first hit, a couple of years ago, nobody really, it's so unknown. It was like, okay, what is this? Where do we go from here? So it was like everybody was like at a scrambling board in a sense, trying to figure out the who, hows, and the whens. But now there's so much more help out there for you. If you're affected, you can still get help for it. It's not as though you're infected and okay, there's nothing, but there is hope. There is a way. Unfortunately, yes, we've lost many, many people behind COVID. But everybody's situation is unique in its own way, and everybody's situation is different. So, we have to look at the now. Where are we now, and what can I do? I just got my first booster shot a couple of weeks ago. And my arm was just a little sore, but I didn't have any other side effects, from it. And yeah, I was one. I was like, not doing it, because that hearsay puts that fear and that doubt in you. But I just took the challenge, and the nurse was so kind. She says, no, she says, come on, Miss Patricia, let's do this. And, after sitting there talking to them and them sharing the handouts with me, it made that difference for me. And I did. I went ahead and got the booster, and I've been fine. And I'm like really glad that I did settle down enough. And so sometimes when we're in situations and that fear about the unknown kicks in, then you rebel in a negative way. So, here we are now, we've got all of this help out here, and people are still looking like, okay, but now what am I going to do? So to that person who's been affected by COVID, what would you say to them at this point?
COVID affects individuals and affects families. I think about all the children who have lost a parent or a caretaker to COVID, or all the people who have had COVID, recovered, but are stuck with long COVID. How much of that could have been prevented? That, it is just a shame that fear has caused so many people to avoid thinking about COVID and avoid getting vaccinated or trying to do things to protect themselves or to protect their loved ones. Especially in South Carolina, I look at our rates of vaccination for children and adolescents. Most of the people age 65 and older are fully vaccinated. And for that, I'm so grateful, because they are the ones who are most at risk. But many haven't gotten their booster yet. And, I do want people to understand that if it's been a long time since you had your first 2 doses, it's not too late. It's not too late to get your booster, even if it's been a year or more since you got your first 2 doses. You don't need to start over. You can still get your booster dose now. And for parents or grandparents of young children, I know COVID-19 is usually not a serious disease, a severe disease in young children, but I have seen children in the hospital, children 5, even younger than 5, in the hospital with COVID-19 who were seriously ill. And we have had some deaths in children between ages 5 and 11 in South Carolina. This is a vaccine preventable disease. Right now, 4 out of 5 children ages 5 to 11 are not vaccinated. They're not protected from COVID-19. And I think it should be considered just part of those routine pediatric vaccines, just like you got your child vaccinated against tetanus or measles. Getting them vaccinated against COVID helps protect them and protect the rest of the family so that they don't bring it home from a school event or from a party or from a day at the pool, making sure that they're not coming home with more than wet towels or coming home with COVID.
Yes, it's just really important that, we follow the information, the guidelines that are out here. The information is available to us. So now it is our time. It's up to us to use what we know. Dr. Keller, the clock is winding down on us, but we really want to thank you for being our guest today and sharing such valuable information about COVID-19, the effects of it, and what we can do. Real quickly, if you would share with our listeners and our viewers information about where they can get more help. And also, as you had mentioned earlier, they could email you or call you. So if you would, before our clock totally winds out, share with them in about a minute what they can do to reach out for help.
Yes, I would recommend reaching out to your local health department. Reach out to your pediatrician. Talk to your pediatrician about whether you should get your children vaccinated. What are the pros and cons? For more information, you can go to our DHEC website. That's DHEC website. If you just Google COVID DHEC, it'll bring you to a wealth of information. People are welcome to email me directly. I'm going to give you my personal email, and that is Kelly JM1. That's KELLY JM, the number 1 at g.cofc.edu.
Well, we thank you, and to our listeners and viewers, we hope that you will contact her for additional information. and go to the website as she has mentioned to you to get that information. Again, I want to thank you for being my guest, and I want to thank my listeners and viewers for tuning in to another show, A Place Called Through, where we do broadcast from WYTV7 Community Broadcasters Network. I am the host, Patricia Wade Goings, evangelist Goings, and I also am a health and wellness and life coach. I am the author of Willpower, The Call to Rise Above. If you like this story and those more that have been shown and those still to come, and you want to be a guest to share your story, please call me an area code of 808-608-9744, or follow me on Facebook at A Place Called Through at Willpower, The Call to Rise Above. Go to my website and you'll find out about upcoming events at www.willpowerthecalltoriseabove.org. Once again, it has been my pleasure to be your host today here at A Place Called Through. Remember to sow those seeds at WYTV7.org. We thank you for tuning in and hope to hear and see you again real soon. Thanks again. Have a wonderful day.